Everybody, I'm going to get started on the telehealth or telemedicine comes forward Insights 2020 webinar series. So we've pretty much been focusing on a lot of the COVID-19 updates lately, but there has been a lot of questions regarding telehealth and telemedicine. So we decided to do an Insights series dedicated to that. Okay, so some topics that we're going to be discussing today: the telehealth basics, relaxing regulatory issues, how telemedicine can help your practice, challenges, and the future of telemedicine. Okay, so starting off with telehealth basics. So first of all, the words telehealth and telemedicine have been, I'm sure you've been hearing them a lot lately, so just a very quick breakdown of the difference between the two. Telemedicine refers to direct patient clinical services. Telehealth is more of a broader definition of remote healthcare services. So that's just a very, very simple explanation of the difference between the two. So they are similar, but there are differences. So there's different types of telemedicine or telehealth that takes place that you may have been hearing about. So something that you might think of whenever you hear of telemedicine is whenever the patient and the provider are talking face-to-face through a video. That is your telemedicine visit. It's a real-time two-way audio and video communication between the doctor and the patient. They could be chatting through a smartphone or a web camera, or if there's some sort of other way to communicate where they can see each other, that's what that is, and that's also called a virtual visit. There's also something called a telephone visit, which is exactly what it sounds like. It is a synchronous telephone conversation. It's happening real time, and the provider and the patient are simply just talking on the phone. So the visit is being conducted through the phone call. The video is not taking place. So there is another type of visit called asynchronous visit. This is a store and forward telemedicine type of telemedicine. It surpasses the need for the medical practitioner to meet in person with the patient. So instead, data such as medical images or biosignals can be sent to the specialist as needed when it has become acquired from the patient. This practice is really common in dermatology, radiology, and pathology. There's also remote patient monitoring. This is the collection of vitals and physiologic information by the patient that is sent to the healthcare professionals for interpretation for monitoring the data. So a lot of times this can be done in senior living in order to help prevent falls and monitor the vital health of the residents. And the last kind is virtual check-ins or digital check-ins. So that's just a brief 5 to 10 minute check-in with a healthcare professional through the telephone or telecommunication device, or remote evaluation of recorded video or images. So it's sort of a lot of it all clumped together. And this information we received from the cms.gov. Okay, so we have a quote here from Chris Jennings. He said that there is an assumption in primary care that you always had to have in-person contact and that telemedicine would be unsatisfactory or wouldn't fill the void. And that has been exposed. Actually, it's safer, it's quicker, and it's easier. If I just have a quick question, I want to see someone and engage them and see that their focus is on me. But do I have to be in an office for that? And for a physician, can I get more things done, be more efficient, and protect myself as well as my patients? People are now seeing this model, which we thought would take years and years to develop, and it's probably been accelerated by a decade. And that is true. So telemedicine and telehealth has been around for a really long time, but it hasn't been adopted, primarily because it took a lot of time to implement, or so we thought, and there were a lot of regulations in place, and we simply thought maybe the patients wouldn't adapt, but we've quickly found that they are. and telemedicine is likely to stay around even after the pandemic is over. So here are some fun facts regarding telemedicine. So telehealth programs used to take almost 2 years to implement, but with COVID-19, that time has been shortened to less than a month. An UpDoc survey found that out of 2,000 respondents, 42% have used telehealth services during the pandemic. There was also a medical group in Oregon that went from 700 telemedicine visits per month to 70,000 per week. That sounds like a lot, but I have seen numbers that were really high. Examples of, they maybe saw 5 a week and now they're seeing 500 a week. So most of visits have been converted to telemedicine. And also, surprisingly, 91% of seniors had a favorable experience, and 78% are likely to use it again for a medical appointment in the future. So as we know, everything is difficult at first, but then once we get the hang of it, it's not so bad. So as long as the seniors can, figure it out and get logged into their appointments, the next time they use it, it will likely be a little bit easier for them. Okay, so now we'll start talking about regulatory issues. So first, we have the COVID-19 telehealth program. So it covers telecommunications, information services, and connected patient monitoring devices. So there is funding available out there through the FCC. It is a part of the CARES Act, and so far they have released, or there is $200 million in funding. Currently, at least the last time I checked, $50 million has been distributed in rounds 1 through 7, and we're currently in the 8th round. It is kind of difficult to get. It's not necessarily a grant, it is funding. But if you would like more information, it is available on the FCC website. They do prioritize who receives the funding, and sometimes interviews are needed. Okay, so more on relaxed guidelines and expanded waivers for the COVID-19 and specifically telehealth. So the agency has added numerous new services to the list of telehealth services reimbursed under Medicare. So we can do behavioral health visits. We can also do some physical therapy through telehealth now, where previously we weren't permitted to do that. Also, federally qualified health clinics and rural health clinics will now be reimbursed for providing telehealth services. So that's something that they hopefully are now aware of, but for as long as we knew, they weren't able to get reimbursed, but now they are. CMS is also waiving the video requirement for certain evaluations and management services, enabling providers to bill Medicare for services delivered by audio-only phones. So you do have to be aware of what types of visits you're having and the type of insurance that the patient has. But audio-only visits are still being reimbursed, just not as much as the video visits. And HIPAA currently is allowing non-traditional platforms. So there are some that are currently allowed, even though they are not HIPAA compliant. We do not recommend using these necessarily. We would recommend using one that is HIPAA compliant, even though they're allowing things like this. At the moment, things are going to change and penalties could occur. So if you could use a video system that is HIPAA compliant, one that is possibly integrated with your EHR system, or another one, and we'll get into more of this later, ones that are HIPAA compliant, that would be best. And patients' written consents are currently not required in all states, but we would also recommend getting the patient's written consent and making sure that you're following all HIPAA guidelines. Okay, so even though there are a lot of great things to come with telehealth, I'm sure after implementing it, you may have run into some challenges. So that's what we're going to talk about next. So some of the primary things that you can probably think of with challenges are in regards to technology. So patients do not always have access to cell phones, computers, or webcams. And sometimes even the doctor's offices don't have access to webcams. So getting the proper equipment has been a challenge for some people. The elderly and chronically ill population may have difficulty accessing appointments. We have heard that that has been a primary issue with the elderly population. Also, there may be a language barrier, so whenever they're going in and reading their consents and things like that, they might not fully understand what they need to do, or if they're seeing instructions on how to get to their appointment. And also, we know that Wi-Fi and cell phone service may not always be reliable, so that is another technology challenge that has come up with the implementation of telehealth and telemedicine. Okay, so some other challenges are patient privacy and HIPAA. So it's always a good idea, we need to get patient consent if we're going to be providing telehealth visits. So if you are requiring written consent, how is that being completed? Are we getting the patient to sign prior to the visit? Is it integrated whenever they log into their telehealth appointment? Systems all have different things that they offer as far as consent goes, and practices all need to have some sort of consent that the patient is giving prior to their visit, whether that be written or verbal, depending on the state that you're in and your practice's policies. Also, as I mentioned in an earlier slide, HIPAA compliance has been relaxed by the OCR. So vendors that have HIPAA compliant communications are listed on the screen. A really common one that I have personally used is the Doxy.me. It was really easy to use, and I thought that it was it's secure. I heard that there was a breach for Zoom. I think Zoom for healthcare might be okay, but just regular Zoom, there was a breach, so just make sure you're aware of that. And another challenge that we see is with workflow. So patients don't check in like they used to. Patients aren't arriving at the office, they're not seeing the front office person, they're then not getting taken back by the medical assistant who is then taking their vital signs and letting the provider know that they're ready to be seen. The checkout process is different. They're not stopping by and scheduling their follow-up or getting a copy of their lab requisitions and possibly medication scripts. So workflow is changing. So one thing that we found helpful with some of the practices that we've worked with is that a telehealth has been a visit type, especially if they're seeing patients in the clinic too. So this helps avoid confusion. A question that came up was, the provider saying they're waiting for their patient to join the Zoom meeting and then they walk into the room, or vice versa. The patient walks into the room and they thought that, or the patient's waiting in person and they thought that they were going to be a Zoom meeting. So making sure that you have a way to differentiate your patients that are telemedicine or telehealth versus in person. Also, take into consideration how copays will be handled. So a lot of copays are being waived at this time. So just make sure that you are aware if copays are being waived. And if you do need to collect money from your patient, how do you do that? Also, how is the patient's insurance getting checked? Because that probably used to happen during the check-in process. Monitoring patient follow-up items such as referrals, labs. How does the patient know that these need to be done? How does the medical staff follow up with these items? And also determine who will schedule the follow-up visits for the patient. Are we going to verbally tell the patient that they need to call in a week or two? Or how does that happen? Is it up to the provider to schedule it? Probably not, but the process has changed and we need to decide what's going to happen now. Some other challenges, so making sure patients are educated and know what they need to bring to the appointment. So just because it's now happening over the telephone doesn't mean that we don't need to now have an updated list of their medications that they're currently taking and things like that. So patients still need to be aware. We need to make sure that they know if they will be accessing the appointment through their phone, through their computer, So we need to just give them education, provide patients education on the telehealth visits or telemedicine visits. Also, make sure that they're aware that vital signs and physical exams will then be limited, and the providers will know that too. So they can't conduct them as thoroughly as they used to. You know, the provider can still see the patient and give them an exam, but things like, you know, examining their heart and they need to check for an ear infection, there might be some difficulty and the patient might have to come in if it's serious enough, and that's up to the provider to determine if it's, you know, if the patient should come in and be seen or if it's okay to conduct it over telehealth. Also, deciding when and where to have telemedicine visits. Quiet and private rooms are needed for the medical staff and the patient. So we all know that if you're having a face-to-face conversation with someone, you're in your private room, then that's fine. But what if the patient has, you know, their kids sitting on their lap, or the TV's on in the background, or even if you're the doctor, if you're sitting in like a nurse station area and people are walking back and forth and having conversations, it might be difficult for not only the provider to concentrate, but the patient as well. And here's ways that telemedicine can help your practice. So telemedicine can calm fears. It can calm fears in your medical staff and also your patients. So your medical staff might not have to be as exposed to people as they normally would be, especially in the time that we're in now. So it might give them a little bit of peace of mind. Also, high-risk patients can receive care and they don't have to leave their home. Their transportation barrier to care is now no longer there. If the patient has a cell phone or a computer, then they can have a medical visit. So it saves them time. It's actually very convenient for your patients to have their visits from home. Patients with chronic conditions can use remote patient monitoring devices to be monitored by the medical staff. Also, it could improve the provider's productivity because the patient won't have to worry about traffic getting there. They can just log in right from their computer. If they're running late, it's not likely due to something like traffic. Also, it is possible to increase revenue, reimbursement, and reduce costs, and it allows for integrated scheduling. So patients can schedule their own appointments or through patient portals with integrated or even some non-integrated systems with the practice management and EHR. One thing as far as integrated scheduling goes is you'll have to be aware of the cancellations. I have heard that some people or some platforms allow their patients to cancel appointments and the front office staff was not notified. So it's something that you'll definitely want to keep in mind as far as integrated scheduling goes, is making sure you're aware if the patient has the ability to cancel the appointment themselves and making sure that your staff is notified. You may also have the ability to turn off that feature so that the patient would have to call to cancel the appointment if they were no longer able to attend. And here is some information on where we first see telemedicine going in the future. So Medicare lifting the originating site requirements for the pandemic was a big leap forward, and that always seemed to be the issue and roadblock for most groups, is it blocked the use of codes for many urban and suburban areas. And there may be some reform around these requirements. We believe that telemedicine is here to stay. It enables providers to conduct additional visits without requiring additional staff. It reduces hospital admissions and unnecessary ER visits. It provides access to care and patients without reliable transportation, and it can also help with better patient outcomes through those remote patient monitoring devices. And that's all that I have for today. These are the websites where we got some of the information for today's webinar. And if you have any questions or would like to speak with me further regarding telemedicine, on the screen you'll find my contact information. So you can email me at lauren.pacone@careoptimize.com or info@careoptimize.com. And thank you all for joining. I hope you have a great day.